Just as in multiple myeloma, I do anticipate that MRD-based assessments may become a future regulatory pathway for acute myeloid leukemia. However, we do need a number of prospective randomized studies with longitudinal MRD collection and analysis to really establish this as a very tight marker associated with event-free and overall survival. I think in AML, one of the challenges has been the type of MRD assessment as compared to what we do in CLL, myeloma, ALL, where we have historically used flow cytometry, which is effective and quite predictive and sensitive when done in very experienced labs with very experienced hematopathologists. However, I think in the United States, the number of such highly experienced labs and pathologists is limited. Also, flow has to be done on fresh samples, making it difficult for this to be implemented in multi-center international randomized study. And the flow also requires a baseline bone marrow assessment so that we can compare the subsequent longitudinal samples to the baseline to be able to identify difference in the immunophenotype. So we have started moving in the last 5 to 6 years more towards molecular NGS, and especially for FLT3, NPM1, and KMT2A arrangements, as well as a few others. Now there is emerging data with multiple, both retrospective and prospective data sets showing that these markers can be strongly associated with event-free and overall survival. These can be done on stored samples, so they can be implemented in multinational, international randomized studies. And also, we do not need a baseline bone marrow for comparison, which makes these much more attractive, especially when we think about using them in future randomized registration studies. So I do think in the future, we will see, like myeloma, potential use of MRD, not just for academic exercises, but also for regulatory approvals, and also maybe for clinical treatment decision-making, such as which patients need maintenance post-transplant versus not, which patients actually may need transplant in first remission versus those who may not absolutely need it. And I think there's a lot of efforts in this direction, but it's still probably a few years away. And with a number of ongoing prospective studies actually implementing this, I think we're going to have a lot more data in the next few years to be able to push towards using these as regulatory markers.